Pneumonia is one of the killer diseases among the under 5 children in Tanzania. And based on the report that UNICEF did the research of recent, it was found out that more than 16% of the causative of the under 5 death comes from pneumonia. So it's leading one in Tanzania. And with some sort of information from 2019 to 2024, it's more than 700,000 kids under 5 died from pneumonia. And being a chief pharmacist, I'm leading the department within the ministry, that is PSU. And on department that I'm leading, we are responsible to ensure that the commodities for the treatment of pneumonia are available in the country. So we play a very great role from formulating the treatment guidelines for the pneumonia disease, going down to the supply chain of the same, facilitating the models where the medical store department, the regulatory authorities, and the public facilities can access the product and make sure that the kids within the country are accessing the same. So those are the roles that we are playing greatly to ensure that at least all the kids in Tanzania who are faced with pneumonia can access the treatment and make sure that they survive and come back to life as it was supposed to be. Being one of the killer disease, pneumonia, and then we are supposed to look for a solution to make sure that at least those commodities that are needed to be available with advanced technology can be accessed in Tanzania. So we thank the Research for Development, R4D, who came along the way with an idea for bringing up amoxicillin dispersible tablet. Instead of using the amoxicillin syrup, we moved toward the amoxicillin dispersible tablets. But as usual, because that was a new product, the cost of accessing it was high, as well as making it penetrate the market was an issue. So through the Research for Development, with their experience, we are able to ensure that the product can access the market and then it can be accessible within the country. So we started up rolling the product in the country by using doing the diagnosis, actually cross-checking where can we access that product, what is the demand, and what are the kids that can access that product, and actually as well as what are the costs related to those products to be available in the country. So through R4D at the beginning, and we are able to do the quantification, know exactly what can we start with, and with the support from the donor, we are able actually to ensure that at least we start with that product by bringing it in the country. And in a collaboration with the R4D, the government and R4D as a partner, were able to source some of the financing for the initial stock that started to flow in the country. And again, we were able to recruit more of the suppliers within the country to build up the base for suppliers, at least to ensure that not only one supplier, you can have more than one who can be able to supply the product in the country, so that the supply chain cannot be affected along the way. So in that way, we were able to bring amox DT in the country, and we were able to raise its availability from 40 to 48% to more than 93% in 2023. And so far as we are speaking, all the guidelines recognize the amox DT as one of the treatment regime for the pneumonia for children under 5 years of age. And also the doctors, the nurses, the pharmacists, they are all aware and they are aligned on that way so that we can manage pneumonia in the country. After that, then we are now looking the way on how we can sustain that availability of that product. But because initially, as I said, we started with the partners, bringing up some of the financing, and the government were doing the co-financing on what have been brought up. So there was a moment of which we were supposed to think and to see how do we sustain without the support from the donors. So with the Result for Development R4D and the government, from the point where my office is, we are able to come up with the solution by integrating the commodity within the normal and the routine supply chain that the government is running. And from that moment, we are able to recruit some of the financing within the government and make sure that the product is available in the country. As I'm speaking, since 2023, the product is being purchased 100% by the government and is available for free to under 5 child in the country who are suffering from pneumonia, and they are prescribed the same medication for them to be treated. Through market shaping and market management, on ensuring the product can access the market and be available the times, we have learned a lot of lessons from this project. And the first one for me was the focus and consistency to what is supposed to be delivered if it is scientifically proven to be of value to the people. So with the R4D, we had that focus, and we have the consistency to ensure that the product can access the market by using all the means that was available, including training, coaching, and also sourcing, finding the reasonable person to supply the product and make sure that they can be accessible in the country. And the other thing that was a lesson that we learned from this project was the engagement, where we found from the initial stage, R4D were able to engage with the government and make sure that the product is actually well known to the government and is aligned with the WHO guidelines. And then we started from shaping the regulatory part, shaping the guidelines part, shaping the actually even the use at the end. So that one, on that engagement, of which it was very positively done, also helped us to ensure that we can achieve what we are ought to achieve. And the other area of focus was looking the model on how we can finance towards sustainability. That's the lesson learned. So the government, at the initial stage, we could not afford straight to have that product in the country. But with the engagement with the partners, looking for alternative sourcing and bringing up the government to co-finance the project, then it was something that brought up the result that currently we are all enjoying. Looking forward and making sure that the product are available, currently we are tirelessly working with the R4D towards the forecasting and quantification of the commodities to ensure that the currently workers at the facility, the system is in place to accommodate what has been built up for sustainability purpose. And as a government, we are looking forward to increase the financing on the area of buying the amox DT to combat the pneumonia, because still it's a disease of which we all fight for, to ensure that our kids are safe from that point. We are engaging with whatever partner that is coming up to ensure that we sustain the gains that we have from the R4D and the government. Because we are looking forward, we know pneumonia is from bacterial infection, and it's curable. So having the right medication, which is proven to be effective and efficient in treating pneumonia, is a way to go to combat pneumonia in the country.